Welcome back to Houston Life. If you've been suffering with tired, achy legs, or maybe you've been having trouble sleeping because of restless leg syndrome, those symptoms could be a sign of vein disease.
Yeah, this was the case for Wendy Garcia, who found relief through treatment at Reincke Vein Center in Sugar Land. Mel Camp explains.
Mrs. Garcia originally came to me. She was referred by her primary care physician. Her chief complaint or primary concern was restless legs, which were interfering with her sleep, as well as heaviness in her legs that progressively had gotten worse over, say, the last 10 years or so, and also was getting worse with increase in exercise. So she would feel like at the end of exercise that her legs were much heavier, as if she had done a longer distance.
She is a wonderful person. Her staff are wonderful.
Hey, how are you?
I'm good.
How are you doing?
Very good to see you again. You ready for your procedures?
Yes, I am. Hi, Dr. Reincke.
Morning, how are your legs feeling?
Oh, fantastic.
I love it so
much.
Come on back.
Let's talk about the symptoms that you were suffering with your vein disease.
Primarily after exercise, my legs would feel so heavy, tired and heavy. You know, that feeling of weight on your legs. And the other thing was restless legs at night, being awakened by the symptoms of restless legs. That if anybody that has that knows, it's very difficult to sleep. Getting up through the night, walking around, trying to relieve it, you know. So that was my other symptom. I came to Dr. Reincke obviously with some symptoms, but I also had bulging veins in this area, pretty significant, and some back here too, enough that I wouldn't like to expose my legs.
After treatment, Wendy noticed the vein that had troubled her was no longer bulging.
Now I can see you've got a little subtle sort of brown discoloration here.
Yeah.
Is this, in this area you said is a little bit tender, correct?
Tender.
So on ultrasound we can see that that is a closed vein, and the little subtle discoloration is due to iron that's in the blood now that we've closed that vein, and it's staining the skin just a little bit along the course of the vein. Can be very normal and usually will resolve with time. So we tell patients, yes, all this can be normal, but with the tenderness, patients can use ice and take, say, an over-the-counter anti-inflammatory. If they have any further concerns, or say, for instance, the tenderness were to get worse, they have 24/7 access to me, or they can call the office and I'll have them come in, do an evaluation, and see where we need to go from there. But I mean, that's very infrequent that it would get to that point. And at that point it's called phlebitis, so it's just bad inflammation. It can happen, and we try to educate our patients that this can be something to expect.
Yeah.
Explain your quality of life before seeing Dr. Reincke versus after coming to the clinic.
I definitely feel more secure because I feel I'm healthier. I feel that exercise is very important in my life, and I can resume.
That's best case scenario, is that their symptoms go away 100%. But I always tell my patients, you know, I'm not a magician. I don't have pixie dust, so the goal is to decrease symptoms, but they may not go away 100%. And so that's managing patient expectations, and just getting them to understand that yes, you have symptoms, but there are other things that can lead to leg heaviness or even restless legs. It may not be related to the vein disease. So they may still have some even after treatment.
Here I am, symptom-free, and my treatments are finished, and I really will miss them. I might just come in and say, hello.
And And Houston Live viewers can get a free consultation with Dr. Reincke at Reincke Vein Center in Sugar Land.
Yeah, their phone number is 281-394-4446. And if you want to check them out online, it's ReinckeVeinCenter.com.